Hey everyone, Dr. F here with Lisa, and she's going to go through how she's responded to the NUCCA technique and the other techniques we use in our corrective process. So, Lisa, take it away.
I came to Gardner Schofield about 2 months ago because my neck was really bothering me. I also had some sciatica I'd been dealing with for a couple months and had been living with chronic hip and back pain for about 7 years. It affected a lot of areas of my life negatively, particularly when I would try and sleep at night. I would pretty much toss and turn the entire time because I couldn't stay on either side for very long. So I was pretty fatigued most of the time. Some days it hurt even just to walk. I really enjoy yoga, and I found there were a lot of basic poses I couldn't do comfortably, and also riding in the car for any length of time was really uncomfortable, and trying to get out, I felt like I was about 90 years old. When I was first diagnosed with this hip and back issue about 7 years ago, I went to an orthopedic doctor who wanted me to go on some anti-inflammatory drugs long term. I didn't want to go that route. He referred me to a physical therapist who helped with some stretching that did help my muscles but didn't really help with the pain. After a few years, I decided to try a chiropractor, and that did make a big difference in my life. But it was kind of a temporary, it would help for a while and then it would go back. And also, I have to say, I didn't really enjoy the cracking very much. It's a little intimidating when your neck is cracked, even though I had full trust in what was being done. So I came here primarily just to have my neck fixed, but then when I learned about the NUCCA process and all that it could potentially do for me, even though it sounded far too good to be true, I decided to give it a try, and everything went exactly as they said it would. And there was a short period of time where there was more discomfort, but I followed what they said and cannot believe how quickly I feel 100% better than I have in years. I wake up some mornings now and realize that I slept through the entire night. I can walk well, I can ride in a car comfortably, I can do all of the yoga poses without modification. And then there are areas beyond the removal of pain that have made a big difference too. My digestive system became incredibly regular, which had not been the case my entire adult life. I feel more energetic during the day and definitely better able to focus at work. So, and I also want to say that from the moment you enter this office, it will be evident how much both the staff and the doctors really care about their patients. And I always leave here feeling much more relaxed when I come in, which is a huge bonus.
Well, thanks for sharing, Lisa. All right, and there we go. These are Lisa's before and after x-rays. So the before is on the left. So you can see she's got atlas laterality of right 2.38. She's got a lower angle of 2.89. Her plane line is going down slightly. Raise that over a little. Head tilt of almost 2.5 degrees. Angular rotation of 3 degrees. So she's out of alignment, creating a lot of pressure on her muscles, joints, and nerves, and that's what's creating her problems. So I adjusted her and I posted her. She had a lot of fatigue initially. So you can see the lower angle, the lower neck is centered nicely. The upper neck is kicked up just a little bit, which happens quite often. That's okay. Head tilt's better, but she was leaning a little bit. So I had her rest and then x-rayed her, and boom. Head tilt gone, neck centered, upper neck almost perfectly balanced. So now she's looking really, really good. And this is what's so fun about Upper Cervical Chiropractic, NUCCA, is there's no guesswork now. So the techniques, the orthogonally based techniques like orthospinology, Grostic that do this, you don't have to, you know that person is going to do better. As long as that body holds in that position, you've literally turned the power on. The nervous system is going to start healing. And like with Lisa, there's going to be a lot of secondary benefits like her digestion and things like that. Sleep very commonly gets much, much better. A lot of sinus allergy issues, asthmas get better, blood pressure lowers. So there's a lot of secondary benefits when you turn the power on and you get that nervous system functioning at 100%.